so don't mind me sitting on the floor. I'm just trying out my new Canon 90D camera, and it is so much harder than using an iPhone to film, but I'm gonna try it and we'll see how it goes. So let's get right into what I want to talk about today, and that is what is a hygienist and what is a dentist, and if you're a hygienist, do you want to be a dentist? So a hygienist is what I did for 6 years, private practice, and what you do is basically, in layman terms, you clean teeth, you know. Most people are on 6 months recall. Periodontally involved people are mainly on 3 to 4 month recall, and you would do prophy or scaling and root planing. And so for those people in high school, which I got some questions from, that's basically what the hygienist does, and they are able to take x-rays. They're able to inform the patient's oral hygiene instructions. Then they take out all the calculus, or layman terms tartar, from the teeth, and they basically do the cleanings for the patients. What they cannot do is exams. So when you go for a cleaning, you get your teeth cleaned, and then the dentist will be the one to come in and check your teeth and do what they call the dental exam. A hygienist, however, can do oral cancer screening. In fact, they should be doing that at every single appointment. They can talk about anything oral health related, like tobacco cessation, and all that. So a main obvious difference is that the hygienist is not a doctor. A dentist is a doctor. Hygienists go through less school than a dentist. Typically 3 years. You get your first year doing all the core courses, at least that's what I did, and you usually get paid by the hour, at least in Canada. For me, it was around the range, like I said, $35. The highest was $50, depending on your boss. And right now I don't know what the market is like, honestly. That was about 13 years ago, what I'm telling you guys. But you do get quite a bit of money, and you get a really nice schedule of going to work 8 o'clock and then coming back at 5, or some starts a little early, 7 to 4, and you get a lunch break. You can temp if you don't know what kind of practices you want to be in, and you can go to temp agencies. They'll sign you up. You get like a text the night before, an email the night before. They ask you, hey, someone's sick in this office, do you want to go in and help out? And you say yes or no, and they typically will pay you more. So I got paid like $55 per hour when I was temping, because they know that you're not used to the office and you're taking your time out to do that. So that's a great way for you to kind of temp around, to know what kind of an office would be a good fit for you when you first start out hygiene. Now, dentist is very different. You basically have the entire scope of practicing dental hygiene. So the hygienist is limited in their scope of practice, whereas dentist, being a doctor, you can do everything that a hygienist does and more. So you would also have to know about root canals. You would have to do diagnosis on caries and all the periodontal diseases and everything. There's so many diagnoses in dentistry, I can't name them all, but you get the idea. People don't just go in there for their teeth to be clean. They can have cavities, they'll get gum diseases, they may be missing a tooth, and as a dentist, you're well-rounded, and you should know how to treat those cases. And if the complicated case, then you can make a referral out to a specialist. So because of that, dentistry require more schooling, because there's a lot to learn. And I'll make a video on how to apply to dental school and dental school interviews and all that in the future. But also, I should talk about this. A lot of dentists own their own practices or their associates. They first usually start out as being an associate, then they eventually buy the practice that they're in, or they do a startup practices. There's many other ways to go about that, or they can just straight out buy a practice out of dental school if they have the funds to. And because you become a practice owner, or even as an associate, you have staff that you have to manage and all that. Whereas a dental hygienist, you're usually being hired unless you're an independent contractor. I never went down that independent contractor road, so I can't really tell you much about that, but that would be different. But I'm talking about a hygienist typically working in a dental office. So the good thing about that is you don't have to worry about paying the staff, because you're part of the staff. You don't have to worry about all the stress of becoming a business owner and all that. You do your job from 8 to 5 and then you're home and you're pretty stress free. So I would say in terms of stress, dentists definitely have a lot more stress than being a hygienist. In terms of another thing I want to talk about that people often forget is how hard dental hygiene is on your body. So you may not realize, but I read a study and it says that dental hygienists get more back pain and back aches and musculoskeletal problems than dentists. And that's because dental hygienist is doing the same thing over and over again, and that's repetitive motion. Whereas the dentist, maybe they're doing a root canal right now, and then they're doing a filling, so their hand motions and movement is always different. They also have assistants to pass them stuff. So you hold your hand out, and then your assistant really knows you. They know what to pass you based on your hand gestures. It's weird, but you get connected to your assistant, especially if they work with you for a while. But as a hygienist, you're doing solo. You have yourself. You're doing the section. You're doing the cavitron. You're doing the hand scaling, and you are doing repetitive motion. And you want a fulcrum, of course, to minimize the risk of carpal tunnel. But by doing the same thing over and over again, and for years, a lot of my friends who are hygienists develop hand problems or back problems. Not saying that dentists aren't prone, they are. But if you think about it, between a dentist and a hygienist, the hygienist is even more at risk. You don't get to do just something and then walk away. A lot of the times the dentist, put on a rubber dam. They can wait till the numbing of the patient start and then come back. So they kind of get to move around a bit. And the assistant, like I said, really helped out a lot to minimize all the hand movements. So that's something to think about for sure. So hopefully this gives you a good idea of what it's like being a dentist versus a dental hygienist. And you can think more about that. And that's about it. If you have any questions, please let me know. Please like, comment, and subscribe. If you want to know more about dentistry, dental tips, how to get into dental school, and also if you like any beauty, because I will do beauty, skincare routine, and all that, especially now I got this fancy camera. Alright, take care. Bye.